I am so pleased to see so many faces that I know and some that I am getting to know. We've got old friends, we've got new friends in the audience, and that's the goal of this whole event. This is not a typical CME event. What we want to happen here is we want to create new relationships and renew old relationships that will lead to this whole process of changing the way that pain and substance use are managed in the state. And hopefully we can spread this around the country. We're going to learn from so many people that have great ideas, that are doing wonderful things in this arena. So I want to start off. My name is Dan Crowe, Senior Medical Director with Superior HealthPlan. And I have had the honor of being able to put together this group, and I'm hoping that you're going to leave after the end of Saturday with some really new ideas, some new concepts about how this can all be done. And we're going to, I think, find this to be an opportunity to continue these relationships. And I'm hoping that through the exchange of information and connections, we can really make a big impact here. We always have to start off with acknowledging and honoring our sponsors, and we've got them listed up here. So thank you to our organization, Superior HealthPlan, and also to the Meadows Mental Health Policy Institute, the Hogg Foundation, the St. David's Foundation, and the Dell Medical School, all of who have been instrumental in helping us to get this to come together and happen. So we're really, really proud of their sponsorship. So I wanted to start out with an anecdote. Actually, this just happened a couple of nights ago. I was having dinner with friends, and one of them happened to know a guy named Tom Petty for a long time. And we all sat around and were shocked to hear the news that it hadn't been a heart event that killed Tom, but actually an overdose from a combination of very potent opioids, benzodiazepines, and other drugs. And everybody is aware that there have been just a slew of celebrity deaths associated with opioid use disorder and with combinations from multiple drugs. But the real thing that we need to acknowledge is that this is much more than celebrities. This affects people across the entire spectrum. And almost everybody knows someone that has somehow been touched by this. And we want to be, the projections are there's about 67,000 people that will die from opioid overdoses and related drugs this year alone. And that's grown since 2014 by about 20,000 people. So it's just an amazing epidemic. And the whole idea about this is that we can't keep doing what we're doing now. It isn't working. And so I was lucky in college. I took a course in my senior year before starting medical school on science and government. And it was taught by a professor of the history of science. And he introduced me to this man, Thomas Kuhn, who wrote an incredibly important book that was published in 1962 called The Structure of Scientific Revolutions. And it really was Kuhn who coined the term paradigm and paradigm change. And I wanted to highlight that because what we're talking about is in the evolution of science, science is thought often to move in small steps, incremental, and that those things eventually lead to new ideas. But the truth is that science leaps forward at times when the current thinking suddenly undergoes a big transformation. And if you think about it, going centuries back, the ideas that were put forth by Galileo and Kepler changed the whole view of how the universe is viewed, from an Earth-centric to a solar-centric view for us on Earth here. And we move forward to Newton and his ideas about physics, which were then overturned completely in the 20th century by Einstein and his thinking. And in the century before that, Darwin and the impact that he had. And all of these things occurred because the current paradigm had reached a point where it was beginning to fray. And if we think about where we are now with our current paradigm in managing chronic pain and substance use, it is totally frayed. It is so really disorganized and dysfunctional. And it has led to this approach to managing chronic pain that is really a reductionist viewpoint. It really is focused on nerve endings and joints and ligaments, and that leads to a procedural approach to managing chronic pain. And yet the evidence is not out there that says that this leads to long-term functional improvement. And at the same time, when primary care docs, because of inadequate training and inadequate support for managing these very complex people, they get frustrated and they refer to the pain specialists. And there's many pain specialists who do not want to address dependency and addiction issues, and so they get neglected too. So we want to change all that, and our goal is to really focus on a multidisciplinary team approach to managing chronic pain with a very strong behavioral health focus that really stresses the importance of recognizing what are the root causes for chronic pain. And often it really traces right back to childhood traumatic events that somehow have permeated the neurological networks in these people. And when they first get exposed to opioids, there's something that happens. There's a trigger event. And we're going to be hearing a lot about that today as we get some of the best thinkers in the neuroscience of pain and approaches to pain that I think will change your thinking and the way we approach this. So we've got a lot of great opportunity here. I wanted to mention again that we're talking about how this current paradigm has emerged, and much of it has to do with the fact that we have a market-driven medical system. The fee-for-service system is broken. It leads to a predominance of the procedural approaches to managing these things. We've got to change that, and we're going to be hearing about alternative payment models tomorrow as one of the things that I think will help the system change. Marketing had a lot to do with this too, and most of you have probably heard about the effect that the Sackler brothers have had on the system, and how Arthur Sackler took the lessons he learned from marketing Valium in the 60s, passed it on to his brothers who had just purchased Purdue Pharmaceuticals, and with that they launched the new media messaging to providers that demonstrated that we needed a new way of tackling pain that included all non-cancer pain needed to be treated with opioids, and it was a perfect introduction of oxycodone and OxyContin to the market, and we all know where that has led us now. So the other thing is marketing to consumers, and also JACO adopting the fifth vital sign, where pain was the medium for measuring whether or not a hospital was successful in treating patients. And then the consumer ratings too have led to the development of many approaches by hospitals and providers in trying to tackle pain and leading to unforeseen consequences. There's been a number of great books that have been published on this subject, and we've all seen too how the market for street drugs has exploded on this, and I'll show you in a minute some of those books in case you're interested in reading more about this. And then mobile phones and the internet have connected access to street drugs in a way that has taken the idea of going down to a seedy corner and trying to buy heroin is now as simple as getting access on your cell phone and having somebody drive to where you are and delivering your bag of heroin. So what we want to go towards is this idea of multidisciplinary teams that are evidence-based, trauma-informed, connected with the healthcare ecosystem, with information exchange, data-driven, with alternative payment models, with quality improvement built in, and with fully integrated behavioral health and physical health. That's one of the key things that I want to stress, is that the programs that really have achieved full integration are going to be the ones that are very successful at managing these issues. Some of the things that we are doing at our health plan, we're the largest Medicaid managed care organization in the state. We're developing databases that will be searchable by the superior staff and for members and providers to be able to really find the best care that's out there on a local level. So the best physical therapists, the best cognitive behavioral therapists, the best yoga therapists, the best EMDR therapists, the best pain specialists, addiction counselors, addiction medicine folks, all of these multidisciplinary approaches that you can find hopefully and therefore have more than just referring to your pain specialist as a ways of managing this. And then with Project Echo, which you're going to be hearing a lot about, develop a learning community for primary care providers that will allow them to feel that they've built the confidence and the competence to manage these complex patients. So that's going to be an exciting part of the events over the next couple of days. And our plan is from what we learned from all this, we want to share with the other managed care organizations. We want to share with the state, with the rest of the country, with the rest of Centene, our parent company. And I think it'll be an exciting next few years as we watch this whole transformation occur. This is a map that we put together at Superior, and it's a searchable map that you can go dig down into local communities. Every blue dot on there is one of our members that is either on 3 months or longer of chronic opioid therapy or has had a diagnosis of chronic pain. And what we want to be able to do is overlay that with all the buprenorphine prescribers. Which are now highlighted on the map here. And as we can see that there is not adequate access to MAT based on their current status. And many of these prescribers are not accepting Medicaid. So our goal is to change the way that this looks. This is a map of the United States that shows where all of the MAT providers are throughout the country. And one of the most striking things about this map is the way that New Mexico looks here in this area. It's essentially the whole state is painted purple. And then compare that with Texas that looks like we've dribbled a few specks of purple paint on the state. What we want to do with this is by getting access to MAT through primary care providers who are using the ECHO model and who take the course and are able to prescribe it, we want to turn Texas into a purple state too. So, a couple of housekeeping things. Here are some books that you might want to take a look at. I think that they're all very eye-opening, different sorts of approaches, but I think that it's a great opportunity if you have a chance. The compliance statement basically says that you can't, during this whole event, go into a corner and start talking about financial arrangements that you're making while you're here. Basically, we want this to be an event that the whole goal is improving the care for patients and people, and not figuring out how to use the system to do things that currently have led to some of the problems that we've got here. So one other thing. We've got breaks built into the day. The bathrooms are that way. very close by. Internet access, I believe it's SCI if you want to join that network. I don't think there's a password required for that. We've got lunch, which will be provided, and the big goal, like I've said, is that you really get a chance to exchange your access, your emails, build friendships. Take away from this that we want this to become a big learning collaborative community. So I have the honor now of introducing our keynote speaker. Clay Johnston is the dean of the Dell Medical School. And for many of you who aren't aware, the medical school is now going on to its third year. It's been an amazing thing to see this school grow, and it's been the guidance of the dean that has made all of this possible. And I think many agree that the medical school here in Austin is probably the leading cutting-edge medical school in the entire country. He's got a vision that I think began in San Francisco when he was at UCSF, and he's brought down a bunch of the like thinkers from San Francisco, from around the country, some of the leading people in the entire ecosystem of healthcare are joining the faculty here, and he's brought in an amazing group of medical students and residents too, and they're accessing training through our FQHC network here in town too, so that leads to a lot of potential great things to come from that. So without further ado, I'd like to introduce Dean Johnston and give him a chance to tell you about what they're doing. Just